Hello, and welcome to our webinar on Modifier Monday, Chiropractic Services, and Use of the AT Modifier. My name is Jennifer Boniface, and I am one of the nurse analysts with the Provider Outreach and Education team. Today's webinar will focus on the Medicare requirements for chiropractic care, including use of the Modifier AT. On this next slide, we do have our disclaimer. It states that this education is for informational purposes only. Medicare rules changed often, so please make sure you're looking at official CMS communications for the most up-to-date rules and regulations. And remember, those do take precedence over anything that we present today. And just as a reminder, CMS prohibits recording of this presentation for profit-making purposes. This presentation is being recorded by us and will be reposted on the WPS GHA training page under Encore Presentations. So on this next slide, there is a list of acronyms that we may be using during this presentation. And if there are any acronyms you are unfamiliar with, please refer back to the slide for some guidance. Thorough documentation is essential in chiropractic care, especially when billing for services under Medicare. Proper documentation serves several important purposes. It ensures compliance with these Medicare requirements, reducing the risk of denied claims. It allows the provider to demonstrate proof of medical necessity, and it provides the necessary details for submitting claims, ensuring chiropractors are reimbursed for the services they provide. During today's webinar, we will review coverage criteria for chiropractic services, discuss documentation requirements of chiropractic services, review use of Modifier AT, and provide tips to assist with ensuring proper documentation for chiropractic services. Medicare Part B includes coverage for chiropractic services, specifically the manual adjustment of the spine when performed by a chiropractor to address vertebral subluxation. This refers to instances where spinal joints do not move as they should while maintaining intact contact between joints. Medicare does not provide coverage for additional services or tests prescribed by a chiropractor, such as x-rays, massage therapy, and acupuncture, except in cases where acupuncture is specifically for the treatment of chronic low back pain. Once the Medicare Part B deductible is satisfied, the beneficiary is responsible for covering 20% of the Medicare approved amount. Medicare provides coverage for manual Sorry about that. My computer just turned off. Medicare provides coverage for manual spinal manipulation when necessary to treat spinal subluxation. A subluxation is defined as a motion segment in which the alignment, movement integrity, or physiological function of the spine are altered, even though contact between the joints surfaces remain intact. Manual manipulation involves hands-on treatment of the spine. Chiropractors may use handheld manual devices wherein the force exerted by the device is manually controlled for the purposes of performing manual manipulation of the spine. However, Medicare does not allow for separate payment for the device or use of the device. Additionally, there is no coverage for payment or other diagnostic therapeutic services provided by a chiropractor or under chiropractor's orders, such as ordering, administering, and or interpreting x-ray or other diagnostic tests. For Medicare to cover chiropractic treatment, the following criteria need to be met. The patient should be experiencing a significant neuromuscular condition that requires treatment. The manipulative services must have a direct therapeutic relationship to the patient's condition. The manipulative services must provide reasonable expectation of recovery or improvement of function. The outcome from chiropractic services needs to be achieved within a reasonably foreseeable and generally anticipated time frame, and the patient must have a subluxation of the spine demonstrated by x-ray or physical exam. There are two types of subluxations we're going to discuss, acute and chronic. Acute subluxation, or sudden and immediate displacement, is used when a patient is being treated for a new injury. With acute subluxation, treatment is expected to significantly improve or halt in the progression of the patient's condition, and this is considered active or corrective treatment. With chronic subluxation or long-term or recurring displacement, the patient's condition is not expected to significantly improve or be resolved with further treatment. However, some functional improvement should be expected with continued therapy. This is also considered active or corrective treatment. Once a patient's condition becomes stable and further treatment will not result in any improvement in the patient's condition, the treatment is considered maintenance therapy and is not covered. Chiropractic services that are not covered include, but are not limited to, laboratory tests, x-rays, office visits including history and physical, physiotherapy, traction, supplies, injections, drugs, diagnostic studies including electrocardiogram, orthopedic devices, and nutritional supplements and counseling. Medicare also does not include coverage for chiropractic treatments targeting areas beyond the spine, CPT 68943, including the head, upper and lower extremities, rib cage, and abdomen. Documentation needed to support chiropractic services include the patient's name and date of birth, medical need, notes from the initial visit, treatment plan, date of service, numbers of regions manipulated, method of manipulation, provider's dated signature with credentials listed, other documentation supporting medical necessity, including but not limited to abbreviation logs, acronym definitions, and signature logs or attestation statements, and advance beneficiary notice of non-coverage if given. We are now going to take a deeper look at some of the documentation requirements for chiropractic services. First, let's start with medical need. Documentation of subluxation can be demonstrated by x-ray or physical exam. X-rays need to be taken within 12 months before or 3 months following the beginning of the treatment. For certain instances of chronic subluxation, such as in scoliosis cases, Medicare could consider an older x-ray valid if the patient's medical history indicates the condition has persisted for more than 12 months and it is reasonable to conclude the condition is permanent. A previous CT or MRI showing subluxation of the spine is also acceptable. I'm sorry, my slides just went forward. Documentation should include a review of an x-ray, MRI, or CT and should denote the level of subluxation. Medical need can also be demonstrated through physical exam using PART or PART. P stands for pain. Pain or tenderness should be assessed based on factors such as location, quality, and intensity. This can be completed through observation, palpation, percussion, and or use of a pain scale such as a 1 to 10 scale or through a pain questionnaire. And make sure to provide detailed information when addressing the topic of pain. A stands for asymmetry or misalignment. This can be completed through observation and or palpation. Make sure to include documentation to identify the sectional or segmental level of asymmetry or misalignment and how this was determined. R stands for range of motion abnormality. This can be completed through observation, motion palpation, and or range of motion or measuring devices. And make sure to include documentation to identify changes in active, passive, and accessory joint movements resulting in an increase or decrease of sectional or segmental mobility. T stands for tissue and or tone changes in the characteristics of contiguous or associated soft tissues, including skin, fascia, muscle, and ligament. And this can be performed through observation, palpation, use of instrumentation, and or test for length and strength. When using physical exams to support medical need, the documentation must show at least 2 elements of PART. Requirements state that one of the elements that must be present in the documentation is A, asymmetry or misalignment, or R, range of motion abnormality. Next, we will discuss initial evaluation. For the initial evaluation, there are several elements of documentation that need to be recorded in the patient's record. First is history. The history should include the date of initial treatment, description of a current illness, symptoms causing patient to seek treatment, including documentation of symptoms related to the level of subluxation, family history if relevant, past medical history, including general health, prior illness, injuries or hospitalizations, medications and surgical history, mechanism of trauma, quality and character of symptoms or problem, onset, duration, intensity, frequency, location, and radiation of symptoms, aggravating or relieving factors, and past interventions, treatments, medications, and secondary complaints. The second element is contraindications. Chiropractic treatment involves use of dynamic force or dynamic thrust. Dynamic thrust refers to the therapeutic force or maneuver applied by the chiropractor when manipulating the anatomical area under consideration. There are two types of contraindications, relative and absolute. Relative contraindication is a situation where there's an increased risk of patient injury from dynamic thrust, although it does not entirely prohibit application of dynamic thrust. This risk should be discussed with the patient and then documented in the patient record. Examples of conditions with relative contraindications to dynamic thrust include articular hypermobility and circumstances where the stability of the joint is uncertain, severe demineralization of bone, benign bone tumors of the spine, bleeding disorders in anticoagulant therapy, and radiculopathy with progressive neurological signs. An absolute contraindication is a situation where a dynamic thrust is absolutely contraindicated near the site of the identified subluxation and intended area of manipulation. And examples of conditions with absolute contraindications to dynamic thrust include acute arthropathies characterized by acute inflammation and lentiginous laxity and anatomic subluxation, or dislocation of acute rheumatoid arthritis and ankylosing spondylitis. Acute fractures and dislocations, or healing fractures and dislocations with signs of instability. Unstable os adenoideum, malignancies that involve vertebral column, infections of the bone and joints of the vertebral column, signs and symptoms of myelopathy or caudal syndrome, and for cervical spinal manipulations, vertebrobacillar insufficiency syndrome, and significant major artery aneurysm near proposed manipulation. I'm sorry, my computer keeps turning off on me. The next is physical examination using PART to evaluate the musculoskeletal nervous systems. Finally, is treatment given on the day of visit, if relevant, should be documented. Documentation should include specific areas and level of the spine manipulated if applicable. And you can indicate the degree of subluxation in the patient's record in two ways: by listing the exact bones, for example, C5, C6, etc., or listing the area of subluxation if it only involves certain bones, for example, occipital atlantal, which is the occiput in C1 atlas, lumbosacral, L5 in sacrum, and or sacroiliac, sacrum and ilium. The chiropractor must specify the precise level of subluxation or exact bones involved to support a claim of manipulation of the spine. On the diagnosis and on the claim, the precise level of subluxation must be listed as the primary diagnosis, and the neurological condition requiring treatment must be listed as a secondary diagnosis. The patient record should also contain a treatment plan. The treatment plan should have documentation of the following components: duration and frequency of visits. The documentation of treatment should address both the frequency and duration of treatment, as well as the medical necessity of the determined frequency and duration. Specifying PRN or return as needed does not fulfill requirements for this treatment plan. Documentation is necessary to support a prolonged course of treatment. Specific treatment goals, objective measures to evaluate treatment effectiveness, and recommended level of care. Finally, all subsequent visits should be recorded in the patient record. Documentation of the subsequent visit should include history, including review of chief complaint, changes since last visit, and systems review if applicable. Physical exam using PART, including exam of the area of the spine involved in diagnosis, assessment of change in patient condition since last visit, and evaluation of treatment effectiveness. And any treatment given on the day of visit, including specific areas and levels of the spine that were manipulated. So now that we've discussed the documentation required during the chiropractic visits, let's review claims documentation. Claims for chiropractic services should include the date of initiation of the course of treatment, symptom condition, also known as a secondary diagnosis code, subluxation or the primary diagnosis codes, date of service, place of service, and procedure codes. Not reporting these items may lead to a denial or delay of your claim. The diagnosis codes are grouped into 4 categories. Group 1 primary codes are the only covered ICD-10 codes that support medical necessity and must identify precise level of subluxation. Group 2, 3, and 4 ICD-10 codes support the symptom or condition, also known as secondary diagnosis codes, and involve short, moderate, or long-term treatment. Group 2 codes are diagnoses that generally require short-term treatment. Group 3 codes are diagnoses that generally require moderate-term treatment, and Group 4 codes are diagnoses that may require long-term treatment. Chiropractors can only submit claims for 3 CPT codes under Medicare: 98940, chiropractic manipulative treatment, spinal, 1 to 2 regions; 98941, 3 to 4 regions; and 98942, 5 regions. When filing claims for manipulative services, chiropractors are required to use an AT modifier. This modifier identifies services as active or corrective treatment for acute or chronic subluxation. When used correctly, the modifier AT should signify an anticipation of functional improvement, irrespective of the chronic nature or repetitiveness of the issue. So let's discuss a little bit more about modifier AT. Medicare will only cover treatment by manual manipulation of the spine to correct a subluxation. The treatment must be active therapy for Medicare to cover the chiropractic services. The active treatment AT modifier was established to aid in distinguishing between active treatment and maintenance treatment. Medicare only covers and pays for active or corrective treatment for acute or chronic subluxation. They do not pay or cover for maintenance therapy. When a chiropractor delivers active or corrective treatment for an acute or chronic subluxation, it is necessary to include an AT modifier on the claim. The modifier AT should only be used when the chiropractic manipulation is deemed reasonable and necessary per Medicare guidelines. Use of the modifier AT indicates the cover services billed are for active corrective treatment, and the provider's documentation supports medical necessity and Medicare coverage guidelines. It is important to note that the presence of the modifier AT does not establish the service's reasonableness or necessity. Contractors may still deny the claim after medical review if the services are not deemed reasonable and necessary. This is why it is important to periodically review updates to local and national coverage policies regarding coverage criteria, as these policies can change over time. Ensure the documentation includes support for use of the modifier AT and reflects active or corrective treatment. So as a review, correct uses of modifier AT denotes active or corrective treatment for acute or chronic subluxation through manual manipulation of the spine, either by hand or by a handheld device. Procedure codes to be used include 98940, chiropractic manipulative treatment, spinal, 1 to 2 regions; 98941, 3 to 4 regions; and 98942, 5 regions. Treatment is expected to significantly improve or halt the progression of the patient's condition. Remember, the chiropractor must specify the precise level of subluxation or exact bones involved to support a claim for manipulation of the spine. On the claim, the precise level of subluxation must be listed as the primary diagnosis, and the neuromuscular skeletal condition requiring the treatment must be listed as a secondary diagnosis. Do not use modifier AT for chiropractic services determined to be maintenance therapy. Again, maintenance therapy occurs when the patient's condition becomes stable, and further treatment will not result in an improvement in the patient's condition. Finally, we will end with a few tips to assist with ensuring proper documentation of chiropractic services. Include the patient's name and date of service on all documentation. Include records of all dates of service on the claim. Ensure all documentation is clear and legible. All entries must be authenticated. All entries should be signed and dated and should be timely. Include legible signatures and credentials of professionals providing services. A signature log or a signature attestation statement should be sent for confirmation of the signature if the signature present is illegible. Handwritten or electronic signatures are acceptable. For electronic records, include the electronic signature policy and procedure detailing the process of signing and dating notes and orders. The provider cannot use a stamped signature except in special circumstances. CMS allows stamped signatures if the provider has a physical disability and can prove to a CMS contractor that they are unable to sign due to that disability. And I have included a link to the signature requirements fact sheet MLN 905364, complying with Medicare signature requirements on this slide, as well as on the resources slide at the end of the presentation. Avoid using non-standard abbreviations. If applicable, use abbreviation key in the patient record. Include any other documentation to support medical necessity of services billed, as well as a copy of the advanced beneficiary notice of non-coverage and any related supporting documentation if applicable. Thorough and accurate documentation of chiropractic services is essential for assuring the best care for the beneficiary, as well as allowing accurate billing and subsequent reimbursement for the services provided. During today's webinar, we reviewed coverage criteria for chiropractic services, discussed documentation requirements of chiropractic services, reviewed use of Modifier AT, and provide tips to assist with assuring proper documentation for chiropractic services. I've included some resources on the next two slides. They contain links to some of the information we discussed today. The first resources slide contains resources from the CMS website. The next resources slide contains additional resources from the CMS website, as well as resources from the WPS GHA website. Please refer to these slides and use them as a reference when reviewing information discussed during the presentation. We are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions in the chat feature and select send to all panelists. So I'm going to ask if there's any questions in the chat.
Jennifer, right now there are no questions in the chat.
Okay, thank you, Mary Sue. So on behalf of myself and Provider Outreach and Education, we want to thank you for attending our webinar. Remember, this presentation will be posted as an encore presentation on our training page on the WPS GHA website. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you join us at future events. Again, thank you for attending our webinar on Modifier Monday, chiropractic services, and use of the AT modifier.